Hey guys, we'll go ahead and get started. So I am Dr. Shelby Rosasco. I'm the Beef Extension Specialist at the university. So today,
Sorry.
oh, you're good.
You introduced yourself.
I introduced myself.
That's
So today I'm going to talk with you guys about understanding mineral requirements for grazing cattle. So I kind of have this talk set up where we actually go through what some of the common minerals are, why they're so important, talk about what happens if we have some excess mineral or toxicity problems and some deficiency problems, and then we'll kind of go through some strategies to think about for supplementation and different options you guys have. So the first thing that I always like to think about with minerals is, why do they matter, right? It seems like a lot of money to be putting out there and you're not really getting a great return, right? You're not seeing these huge boosts in production and all of that. Well, we know that minerals have a big impact on the health and the immune system. They help keep our cattle healthy. They have a really big impact on immune function in our cattle. And so when we enter a mineral deficient state, we actually have decreases in immune function. We'll have weak calves, calves that are underperforming on a health aspect. We know that they have a big impact on bone and muscle growth, and feed efficiency, carcass quality, and then a big one is reproductive performance. And so we want to make sure that even though we're not seeing these big jumps in performance by feeding a mineral, that we're making sure that we're actually maintaining the level of performance and having these animals be optimal, okay? And I always think of minerals like an insurance policy, right? They're helping us keep the animal doing what they're supposed to do. And so the other side of this, there's this wheel, right, that has all these different minerals around it. And I've heard it called a couple things. My favorite one is it's a wheel of misfortune, right? Because all these different lines between these minerals are how they interact. Now that could be positive interactions, but it can also be negative interactions, where certain minerals tie each other up to make them less, the animal have less of ability to absorb them, okay? And so we have to be really considerate when we're thinking about creating a mineral program about how these minerals interact with each other, okay? Now I'm not a mineral nutritionist, right? But a lot of them always say that this is their job security, right? Understanding all of these different interactions gives them job security because they're trying to help us come up with the best mineral programs and understand how we can do that. So just as a quick overview, our minerals are broken down into our macro minerals, okay? Those are, when you look at your mineral tags, they're often in percentages, okay? Or we can consider that parts per hundred, okay? So they're a little bit larger amount that our micro minerals or our trace minerals, okay? But they're still only needed in pretty small quantities, like less than 1% in the diet. But we know that these minerals have a really big impact. Now some of the problems with them is that we have really limited storage capability of these minerals in the actual animal, okay? We do have stores for calcium and those kind of things in bones, but they're not readily available stores. So we generally need to make sure that these animals have a constant supply of these macro minerals. Our micro minerals, okay, they're on your mineral tags, your feed tags are in parts per million, okay? So we need very, very small quantities of these, but they are incredibly important, okay? We need such small quantities of them that we have really narrow levels of deficiencies and toxicities that we're trying to meet in the middle for that optimum performance, okay? Now the really cool thing about our micro minerals or our trace minerals is that we do have storage capacity, okay? The liver in these animals can store most of these trace minerals, so we can have periods where maybe they're deficient, they're not consuming enough mineral, they're in a situation where we can't get mineral to them, where we can enter stages of deficiency and they still have body stores that they can draw from and utilize. Now on this list, on the macro mineral side, the ones we really don't worry about are potassium and sulfur, okay? Generally there is enough potassium in the forages. We're really not concerned with the inclusion of potassium in our actual mineral pack. Sulfur, a lot of times, actually we have a toxicity problem with sulfur, right? We're trying to be very cognizant of what the sulfur content is in our feeds or our forages as well as our water, okay? Because we don't want to enter a toxicity stage with sulfur, we can have really detrimental effects. The ones we're most concerned with are generally phosphorus, magnesium, and sodium. Okay? Phosphorus and magnesium generally are included in your mineral packs or however you're feeding your mineral. Okay? Phosphorus, we do have some included in the forage, but oftentimes we need to include that. Okay? Sodium is basically our intake driver, salt, right? Cattle have a desire and a need for salt, and so we utilize sodium in our mineral packs to actually impact intake, right? We use that to either limit intake or actually increase the palatability of a mineral. So one of the biggest things is that we have a lot of mineral variability, right? Forage has minerals in it, right? It's pulling minerals up from the soil, okay? But there's big variabilities. Even in small geographical regions, we can have some areas, I use selenium as an example. Certain areas on the western side of the state are actually selenium deficient. Certain areas on the eastern side of Wyoming are actually have too much selenium in the soil. And we have situations where we can enter a toxic situation, okay? So even in smaller regions, we have to be really cognizant of the fact that there's variability in our forages, okay? So we need to make sure that we actually understand what that variability is. So that means actually going out and taking some forage samples and testing that, because we know the mineral content can vary by plant species, the soil type, soil fertility, plant maturity, okay? Mineral content generally declines as plants mature and go into a dormant phase. So we need to make sure that we're providing different minerals during different stages of the growing season. And even climatic conditions, so drought, okay? Drought can actually increase minerals in certain forages and decrease minerals in certain forages. So we need to be very cognizant of that. And so the big thing that I'll push for you guys today is testing your forage, right? If we're gonna develop a mineral pack for your region or for your specific ranch, we wanna make sure that we know what you already have. We don't wanna waste money providing mineral that's already an adequate amount in your forage and in your water, and we don't wanna miss something by not knowing that we need it, right? Going, oh, well, my neighbors have this, that should be good enough for me. Well, hopefully it is, but let's make sure. And so we wanna make sure that we test forage and that we also test water, because we can have minerals in that water as well that we're concerned with, okay? If we think we have a mineral issue, right, maybe we're in a deficient stage, we're seeing some clinical signs of mineral deficiencies, okay, we can actually test the animal. We can do that through blood or a serum sample, but really the best way is to do a liver biopsy. Okay, we can take that liver biopsy. It's a really minimally invasive procedure that they can do chute side, takes one little shot of lidocaine, super easy, most vets can do it. That can be sent off, they can analyze that, and that's gonna tell you what those trace mineral stores are for that animal and give you an idea of if maybe you're in a deficient state. So this is a good example. It's hard to see. Some of the numbers are actually red on there, I promise. But this is a good example of some mineral composition of sub-irrigated meadow hay. So this is actually Nebraska data, but it's data from 1999 through 2015. And what I want you guys to get out of this is seeing that we have, like for in phosphorus, for example, we have changing concentrations of the mineral over time, right? So between June and July, we have a decrease to where we're almost below the mineral requirement for those cattle, okay? By October 1st, that's back up, but we need to make sure that phosphorus is one that we don't really store, that we're consistently supplying that mineral and that's available to them. Now, trace minerals are ones we're really concerned about, and we can see here for manganese, zinc, and copper, at all three of these time points, we're in a state of deficiency, okay? We need to make sure that we're correcting that so these animals are at an optimum level of performance. So mineral requirements, not only do they change in the forage, they also change by the animal's age, their weight, what sex they are, the stage of production. So those mineral requirements change from gestation to lactation. Okay, we have increases in calcium requirements at certain stages, increases in phosphorus requirements during certain stages, and they can be impacted by level of performance. So we need to make sure that if we have different groups of animals, that we have a different mineral that's meeting the requirements that they have at these different stages of production, okay? And I know that makes it way more complicated when we're putting minerals together, and I think all I'm telling you guys, right, is let's just add one more thing to the list of complications for minerals. But they are important, and they are something that, you know, you can sit down with your nutritionist or sit down with me or Chance or somebody like that and work through, this is what minerals we need, this is gonna be the most cost-effective way for us to do this. So one question I get a lot, or a comment I hear a lot, is cattle have nutritional wisdom, right? They can go out and they know how to pick out what mineral they need at what time. Wrong. Okay, I wish cattle were that smart. It would make my job a lot easier, right? They do not have the capability to balance their own diet. Okay, they are generally driven by palatability of that mineral or of that diet they're consuming. Okay, so animals will actually select a palatable but poor quality diet in preference to an unpalatable diet, even to the point of death, right? And we know that with our toxic plants, right? They have no way of knowing this has a toxic poison in them that's gonna hurt me. They think this tastes good, I'm eating it, okay? It's the same thing with minerals, right? Now we generally thought this because we'd see cattle chewing on bones, right? They'd be exhibiting signs of pica and doing that. Well, that's not necessarily nutritional wisdom, okay? That may mean they're in a deficient state, but that doesn't necessarily mean that they know how to correct that and balance it properly, okay? So palatability, not metabolic demand, is the factor controlling the amount and frequency of mineral consumption, okay? Salt is the big driver there, okay? That's the thing that they probably pick out the most that they want or they need, and so if we increase the salt content, we can drive intake down, okay? If we decrease some salt content, sometimes we can have that actually increase intake, and sometimes we can actually use salt to actually drive intake. If we know they're salt deficient, okay, we can add more salt to something to drive some of that, okay? So we can utilize salt as a good way to control intake, and we'll talk about that towards the end. So I'll kind of go through some macro minerals and some of the issues they have, okay? Calcium, phosphorus are a really big one. And so forage is often sufficient calcium, okay? If we actually go out and test forages, most of the time we have enough calcium in there, but not always phosphorus, okay? So most of the time we are supplementing some phosphorus. Now the hard thing is that phosphorus is typically the most expensive mineral in the pack, okay? And so if we can find a way around that, that's a good thing. It's going to save us some money in our mineral, okay? But we really want to consider the calcium and phosphorus together, and we want no less than a 1-to-1 ratio, and actually sometimes we want a 2-to-1 ratio, okay? It's going to depend on what you're supplementing them and what you're feeding them, okay? Our forage phosphorus concentrations and digestibility decline with advancing maturity and weathering of that forage, so we need to be considerate of that and maybe consider changing our mineral if we have big swings in what we're feeding our cattle. Okay? Phosphorus supplementation may need to be included when we're on low quality grass hay or on dormant forages, because those forages just don't have the phosphorus content we need. But we actually don't necessarily always have to do this by adding phosphorus to our mineral program. We could actually include it with a protein supplement, because distillers grains, things like that actually have relatively high phosphorus concentrations, so we can correct a phosphorus deficiency by adding that in. And that can save us money by not having to add phosphorus to that mineral pack, okay? When feeding grain or grain byproducts, calcium supplementation may need to be increased some, because we'll actually be increasing phosphorus where we're moving that ratio off of the 1-to-1, okay, that we want. And so sometimes that grain diet means we actually need to supplement calcium to keep that ratio in balance and keeping these cattle healthy. Magnesium is another one that we get pretty concerned about a lot of times in certain times of years and in certain areas. Okay, magnesium concentrations in our forages often appear high enough to meet the needs, and they usually are. Okay, and we can have what's called grass tetany. Okay, and it is a nightmare. We do not want that to happen. Okay, so rapidly growing immature grasses have really high nitrogen and potassium content. And it's actually a lot of times grass tetany isn't necessarily our magnesium's too low in the forages, it's that our nitrogen potassium are too high in the forages, and they're actually interfering with absorption of magnesium in the rumen, okay? So it's not necessarily a primary deficiency, we actually have a secondary deficiency that it can occur there. Now this is typically observed in lactating cows, okay, and in cows in the early spring. So when we have that lush green up of our full season forages, that's when we're gonna see that increase in nitrogen and potassium, and we can see some decreases in magnesium, but that's when we wanna be really cognizant of that fact and make sure that we're actually feeding a high mag mineral, okay? So if we know this is a problem, if it's been a problem in years past, the easiest thing to do is include a high mag mineral, not wait till grass tetany is a problem, because fixing grass tetany is a lot harder than just including a high mag mineral. Now, one problem is that magnesium is not super palatable, okay? So you often have to get a little creative with those high mag minerals, whether they're in a protein lick tub, they're included in some sort of other supplement to make them a little more palatable where those cattle actually want to eat them. So the other one, and we touched on it a little bit already, is sulfur toxicity, okay? There are areas in Wyoming where we have high sulfur in the water, and that makes it a problem, okay? The maximum tolerable concentration is 0.4%, okay? That's the maximum concentration we want in our feed, okay? When we go over that, we start getting subclinical toxicity levels and clinical toxicity levels, and then we end up with really big problems, okay? Then we end up losing cattle. We also need to be cognizant of the fact that there's high concentrations of sulfur in certain byproduct feeds. So corn gluten-free and distillers grains are really good examples of byproduct feeds that have a high concentration of sulfur in those feeds. So if you know that you have high sulfur water and you've got a lot of sulfur in your forages, when you test things, you really have to be careful about if you supplement distillers grains, okay? Because you don't want to tip cattle past that breaking point to where we start having decreases in performance and even having polio or PM set in and have cattle die, okay? So sulfur toxicity, okay, when we reach really high sulfur levels to the clinical toxicity level, we actually have cattle get polioencephalomyelitis, or PEM, or polio for short, okay? Signs of this are going to include restlessness, diarrhea, muscular twitching, labored breathing, blindness, and in prolonged cases, inactivity followed by death, okay? So if you have cattle that start exhibiting signs of this, call a vet, okay? Don't call me first, call the vet. He's going to be able to provide you help a lot faster than I am on that one, okay? Now, we can get cattle to this subclinical toxicity where we're going to have reduced dry matter intake, average daily gain, and it really impacts their rumen, okay? Sulfur is not a friend of the rumen, okay? We do not want high sulfur content, okay? It's going to bind up copper, okay? So copper is often one of our most limiting, most efficient minerals that we have. Sulfur is going to bind that up, okay? It's going to lower selenium digestibility and inhibit incorporation of selenium into enzymes. So even though we're maybe giving them a trace mineral, if we're entering this level of really high sulfur, we're actually limiting the ability of our trace minerals in that mineral path. And we spend a lot of money on those. We want to make sure they're getting utilized, okay? And we can actually have a decrease in immune function in these cattle. So how do we determine a mineral deficiency or toxicity problem, right? Most of the time, if our cattle are healthy, we're not noticing deficiency or toxicity problems. It's really only when we hit clinical signs, okay? So the first thing is to be able to look for clinical symptoms, okay? I have some good resources I'm happy to share with you guys that list what the clinical symptoms are. We can do a forage and a water analysis. That's going to allow us to know what mineral content is in the feed that we're actually providing these animals. That'll give us some indication if we are at a level of toxicity. And we can do the animal tissue samples. So we can do liver samples, are kind of the gold standard, but certain minerals we can do a really good job with serum, okay? So our goal of our supplementation for minerals is to prevent subclinical deficiency, okay? We really don't want severe deficiency or severe toxicity, but we also don't want to be in these subclinical deficiency or toxicity states, okay? We're generally not gonna see really outward signs that they're toxic, okay? We won't see polio, we won't see indications that they're not feeling well. We'll see decreases in performance, and those can be really hard to pick up. That can be, well, I had a lot of repeat breeders this year. I can't talk today. Or, you know, I just didn't breed up as well. Or, hey, my calves are really weak right after birth, and this just doesn't seem right. Or my calf weaning weights seem down from what they normally are. Those kind of things we see when we're in levels of subclinical deficiency or subclinical toxicity. Those are things we want to be paying attention to. Okay, if we go, man, I can't afford the mineral this year, I'm just going to leave it off, and then we see decreases in performance, well, it's likely because we are in a subclinical deficiency stage. Okay, we want to be in this optimal stage. So symptoms of mineral deficiencies, okay, milk fever can be a big one. It's not as big in beef cattle, it's going to be a lot bigger in dairy cattle. Okay, grass tetany in certain areas, white muscle disease in our calves if we're deficient in selenium or vitamin E. Okay, subclinical losses again are going to be things like decreased pregnancy rate, increased calf morbidity, decreased growth rate. They're things that are harder to pick out, right? They're things that maybe we just go, well, maybe the bull didn't do his job this year. Well, maybe that's true, but maybe we were a little deficient in some of our trace minerals, and that's having an impact on reproductive performance. Okay? Subclinical losses reduce profitability and go undetected without good record keeping. Okay, so we need to make sure that we're actually paying attention and writing that down. So when we think about, okay, I'm having decreased reproductive performance, or my growth rate in my calves isn't quite what it should be, we kind of go down this list of what factors could be responsible. Okay, so what do I need to pay attention to? What questions should I start asking? Okay, well, let's take out the big ones first. Okay, are we energy and protein adequate? Okay, if we're making sure that those needs are met, we can check that off the list. Okay, because we know if we're not providing those animals enough protein and energy, that can reduce performance as well. Okay, are my cows in adequate body condition? Are production losses well defined? Can I actually measure and say, you know, I've lost this many calves right after birth, and it's just a lack of vigor, they're not getting up, or they're born alive and then I lose them in the next day, maybe it's a colostrum issue, well, that can still be a mineral issue that we need to consider. Okay, what are our sources of trace minerals? Okay, we can go look at that feed tag and actually look at what sources of trace minerals am I providing, and we can talk about the bioavailability, because we have different bioavailability of our trace minerals, and that's going to impact absorption by the animal. What's our mineral intake? Okay, even if we're putting mineral out, if we're at a 4-ounce mineral, free choice mineral, and they're not actually consuming 4 ounces, they're not actually meeting their requirements. Okay, we want to make sure that we're not over or under consuming that mineral. Have there been recent changes in management? Okay, are we not putting mineral out enough? Are they running out of mineral at certain times? So when we think about subclinical versus clinical issues, again, clinical issues we're generally able to pick out. There's an obvious problem in those cattle. Subclinical are where we start to maybe just see small production changes, okay, small decreases in performance. Okay, generally, once we head towards this level of subclinical mineral status, over time, immunity is the first thing to be impacted. Okay, so oftentimes, one area where we'll see, okay, these animals are deficient is in our calves, right? The calves are just, we're having health problems in our cow, we're having more pneumonia and respiratory issues, we're having weak calves at birth, okay? We're having those kind of issues because immunity is the first thing to get affected, okay? Then growth and fertility is impacted. So as we continue down that subclinical deficiency towards a clinical deficiency, then we start impacting reproduction, and then finally we enter this stage where we have clinical signs of deficiency that are really prominent. So trace mineral deficiencies are a really big deal with our minerals. Okay, zinc and copper are the most common deficiencies encountered throughout the U.S. So Dr. Hall, he was at Utah State, okay, when you listen to him give talks, he will tell you he's tested mineral samples from throughout the country. And the lowest he's seen percent deficiency was 53% of animals in a state were copper deficiency. He generally says 60 to 70% of animals are probably in a state of copper deficiency at some point during the year. Okay? Copper is a big one. These trace minerals really matter when it comes to health, the immune system, and fertility. Okay? Selenium deficiencies also exist in certain areas. Okay? Cows move minerals to the fetus during gestation, and so timing of supplementation is really important. Okay? We want to make sure that we set that calf up right. So it's not just important that cow performance is good. Her performance impacts calf performance, right? We've said with our trace minerals, we can store these in the liver. She starts moving stores of minerals to that calf during late gestation, okay? We actually want that calf to be born with really high stores of the mineral because they're not intaking mineral right when they come out, right? Milk is not high in our trace minerals, so the amount of minerals they have at birth is what they have until they can start consuming mineral on their own. Okay? So deficiency in a calf, so if we have a calf who's weak and we end up taking a sample, it dies, we send a sample off to a diagnostic lab and they tell you, well, it's copper deficient. Okay? That deficiency came from the maternal side. That generally means that that cow was deficient. She physically didn't have enough mineral stores to pass to that calf to provide the immunity that they needed. So late gestation mineral status is also important for dam immune function and therefore colostrum quality. Okay? They're gonna put those fat-soluble vitamins like vitamin E into that milk. Selenium and vitamin E are both really important for immune function. They are antioxidants. They help that calf. So we have to make sure, especially late gestation, that these cows are in an adequate, optimum mineral status. Maternal deficiency due to inadequate intake or antagonist interference is often the case when those calves are deficient. Okay? So either we're not providing enough mineral, the mineral we're providing doesn't have adequate quantities or bioavailability of the minerals we're trying to provide, or we have an antagonistic situation. Okay? So we have primary deficiencies, that's where intake is just too low, and secondary deficiencies of minerals where we have these minerals actually interacting. Okay? So like we mentioned earlier, sulfur, copper, and molybdenum actually will interact and interfere with each other and impact absorption by the animal. And so even though we're providing enough, we're giving them a mineral, we can actually be deficient because of these antagonistic interferences. Maternal deficiencies in our trace minerals are often recognized as their recruit breeders. They have poor conception rates, they have prolonged calving dates, we have non-breeders, so we have more cows falling out of the herd, okay? They can also have poor immune function and poor growth. Okay, a good example is selenium deficiency. A lot of times we'll actually see retained placentas in cattle. Okay, so if we start having an increase in retained placentas, we might want to start looking towards minerals. Are we actually providing enough selenium in that diet? So really some of the important ones, again, we said copper is often deficient. Okay, copper is required for normal red blood cell formation, normal bone formation, and pigmentation. So a lot of times when you hear people talk about copper deficiency, we'll talk about, oh, well, those cattle have that discolor. They have that coppery brown colored, discolored hair, right? That's oftentimes a sign of copper deficiency because we know that copper impacts pigmentation of hair, okay? That's not to say if you look out there and you have a couple calves or cows that have that kind of sun-bleached colored hair, that can be sun bleaching, it can be them shedding out, can also be a zinc deficiency, okay? It can just be that that's a coloring that they have, okay? It's not always indicative of a copper deficiency, okay? But it can be an indicator for us, okay? We know that copper is really important for the immune system, so we want to make sure that we have adequate copper status in those cows so that that can be passed on to those calves, okay? We also know that copper requirements are affected directly by dietary molybdenum and sulfur, okay? And we talked about that a little bit. When we get high levels of moly or molybdenum in the forages, and we have high levels of sulfur, they actually interact in the rumen and tie each other up, and they form this thiomolybdate complex, okay? Once that complex is formed, the animal's not gonna break that down farther down in the digestive tract, okay? That actually gets passed out. So all that nice copper that we paid for is now getting lost, okay? So we're still not meeting requirements if this is happening, okay? Iron can also interact with copper, so if we have high iron in our soil, high iron in our forages, we know that that can actually tie up copper as well, and we can have an iron-induced copper deficiency, okay? This is why I said testing your forages, testing your water is so important. That way we know when we look at the mineral pack you're using, that you're using the right one for your area. So deficiency in copper, we often see anemia, reduced growth rate, changes in pigmentation of the hair, cardiac failure, and diarrhea. Excess copper in the diet can also be toxic, okay? So even though I'm saying copper is always deficient, that doesn't mean load them up on copper, okay? With our trace minerals, we generally have pretty narrow windows of deficiency and toxicity, okay? So we don't want to supplement copper needlessly. We want to supplement the correct amount of copper for what we need and what's being supplied in our forage and in our water, okay? Excess copper can cause interference with iron, selenium, and zinc. So excess copper can actually decrease utilization of selenium and zinc. They all compete for similar transporters within the body, okay? Monitor copper levels if issue is suspected. So easiest thing is call your vet, take a liver biopsy. Call me, I can come help you take a liver biopsy or a blood sample, and we can figure out what's going wrong, okay? Excess copper is not common in our range cattle. Cases generally result due to oversupplementation in a TMR, okay? So if we're on a total mixed ration and we have too much copper in there, that's when we're gonna see these copper toxicity issues. It's generally not in our range cows who are out grazing. Selenium is another big one, okay? It's required for the body synthesis of an enzyme that breaks down harmful oxidizing agents. It is very important. It's very interrelated with vitamin E. So a lot of times when you hear about selenium, you hear about vitamin E in contact with it, okay? Because they do similar things and they work together. So even though I'm not going to talk a lot about vitamins today because that's just going down a whole other path, okay? It's important to note that these two work together and that we want both of these to be in optimal supply to our cattle. Okay, selenium's one where there is an extremely narrow range between deficiency and toxicity. It's one that we want to know if we have a deficiency that we need to correct, or if we're going to enter a toxic phase if we utilize a mineral with too much selenium in it. The USDA actually regulates the inclusion rate of selenium in our feed and in our mineral packs because there's such a narrow window, and they want to reduce how much selenium toxicity issues we have. So signs of selenium deficiency, white muscle disease is the first one. Okay, that's the most common one that we think about. Okay, in our calves, if we have weak calves who are really underperforming, a lot of times it can be white muscle disease if we're in a selenium deficient state. We can also have reproductive failure. Instances of retained placenta is a good indicator that maybe we have a selenium deficiency. Increased calf mortality, reduced calf weight gains, and poor immune function. So we start to see increases in calf health issues, right? We're having more pneumonia, we're having more scours, these kind of things. We're probably having maybe some mineral deficiencies that are impacting the immune function, okay? Selenium toxicosis or toxicity has the same indicators as a deficiency. So we'll see impacts on immune function, we'll see white muscle disease, we'll see reproductive failure. Okay, so it can be hard to kind of tease out whether we have a deficiency or a toxicity problem without doing some testing. So we actually have selenium deficient areas in western Wyoming and selenium excess areas in eastern Wyoming. So it's a fun state. Vitamin E deficiency, like I said, goes hand in hand. The clinical symptoms are the same as selenium deficiency: poor growth, poor immune function, weak calves, white muscle. Okay, that vitamin E is a fat-soluble vitamin that requires intake of green vegetation. Now the really cool thing about beef cattle is that they can store this fat-soluble vitamin. Okay, That's why we don't have huge vitamin E problems, right? Our cattle aren't on green feed all year long, okay? They can store a significant amount of vitamin E for 4 to 7 months. Now, when we start to see vitamin E problems, a lot of times we're in a drought condition where it's been a really long time since they've been on green feed where they would have been able to have intake of vitamin E. So that's when we start to see some of these vitamin E deficiency problems. And so if we're in a drought situation and we start to see symptoms of selenium or vitamin E deficiency, we might want to consider that that drought condition might be a reason. Zinc is another important one. It's really important for normal hoof integrity, okay? And it's also important for spermatogenesis, okay? So we want to make sure that our bulls are included in our mineral program. Okay, since we know that we need zinc for normal spermatogenesis to occur. Okay, so don't leave them out. I know sometimes bulls are the afterthought. They don't necessarily get the same treatment as the cows, right? Because they're only working part of the year, but we want to make sure that we provide them with milk. Okay, so deficiencies can cause decreased weight gain, reduced milk production, reduced reproductive performance, and all of these other fun things on that list, okay? Now we do need to keep in mind, even though again, I feel like I'm just telling you, supplement all of these different minerals, that copper and zinc compete for absorption. And so when we're looking at the ratio of copper and zinc in our supplements, we really want a 1-to-3 ratio because we know that we compete between those two. So we don't want to have that ratio be too far off where we would impact absorption and not be utilizing the minerals that we're paying our good hard-earned money for. So one of the big things to think about when we're picking out a mineral supplement is bioavailability of our different minerals, okay? So all bioavailability means is how much is going to be absorbed and utilized by the animal, okay? So we have several different sources. We have inorganic sources. These are our most common sources that we're going to see. Okay, they are generally what we mine from the earth. They are our cheapest sources of minerals. Okay, where they are oftentimes our like copper sulfates, our carbonates, our oxides, and our EDTA complexes. Those are all going to be inorganic sources. Okay, again, they're the most basic and inexpensive form. Now, the one drawback with them is they're often highly water soluble, and we'll talk about why that's important here in a minute. Our organic sources are ones that we've done some really cool science with, and we've actually covalently bonded them with another amino acid or some other type of ligand. So we've attached them to something else. They have a really strong bond, and it makes it where they're protected against antagonistic interactions. Okay? So we want organic sources are great, but they're also more expensive. Okay, so if we see a lot of organic sources, these are going to be our complex or chelated. They'll have an amino acid attached to them. Okay, they're going to be more expensive. Our last sources are our hydroxy sources. Okay, so they're minerals, generally copper, zinc, and manganese, tightly bound to hydroxy groups. Okay, they are insoluble in water but soluble in acids. Now the reason I'm telling you whether they're soluble in water or not is because the organic sources, since they're water soluble, the pH of water and the pH of the rumen are relatively similar. Now what that means is that they can solubilize in the rumen. So if we have an inorganic source of copper, it is going to solubilize in the rumen. We know that there's sulfur in the rumen. This is going to be when we have these antagonistic interactions happen. Okay, that's not to say don't feed inorganic sources. It's to say we need to be considerate of the fact of what the bioavailability is. Okay, we know if we include organic sources of copper or hydroxy sources of copper, they will make it past the rumen. They can then be broken down by the acid in the rest of the stomach and the digestive tract and be absorbed that way. So we just need to be considerate of the fact of how much copper we need and what the bioavailability is. This all becomes important when you're actually reading your mineral tags, okay? So this site here, that's through University of Missouri Extension. I think Casey Olson put this together when he was there. It is a really great resource in that it actually shows you the bioavailability of each of the minerals. So when you're actually evaluating your mineral tag, you can go to this site and you can actually see what the relative bioavailability is, and it's gonna help you do some comparisons of what minerals sources are actually in the mineral tag, okay? So copper sulfate is kind of the gold standard for copper, okay? It's not necessarily 100% bioavailable, but because it's the most common source, the one that's used the most, we set it at a relative bioavailability of 100, okay? Again, it does not mean its bioavailability is 100%, but when we do comparisons of these other copper sources, so copper oxide is a common one, it's only 15% bioavailable compared to copper sulfate. Okay, our copper chloride tribasic, of our hydroxys, it's 115% bioavailable. So we have more bioavailability in this one. Okay, so this source is a really good resource for you guys when you're looking through this. Okay, I know I'm running out of time, but make sure we keep in mind our antagonists when we're doing our minerals. Okay, this wheel of misfortune, right? Be thinking about that when we're thinking about how we need to balance these. That's where someone like me or your nutritionist or Chance or one of the people at the university can really help you put together a mineral pack and evaluate what you're doing. Okay, some mineral supplementation options. Okay, complete feed. If you are actually feeding in a feedlot or something, the easiest way to do your mineral is to include it in your total mixed ration. Okay. Unfortunately, range beef cows, we don't have a total mixed ration, right? They're out grazing, they're out doing all that good stuff, right? So we can actually add minerals to our supplements. So a protein or an energy supplement that can help with intake of our minerals. Our more common is this free choice mineral, okay? They're in a self-feeding situation. We're using salt as our intake limiter, okay? This is a really good option, okay? Especially if we're really paying attention to intake, making sure that it's constantly available. But we do know that intake's gonna vary, okay? We have boss cows who are gonna go and they're gonna fight to be at that minimum fetal first and not let those cows who are a little bit lower on the food chain, lower in the hierarchy, over to that. So we need to make sure that we're providing enough space for cattle to consume minerals and enough opportunities. Blocks are an option, okay? They generally don't include a lot of our trace minerals, so if we have trace mineral deficiencies, blocks aren't always the best option for us. Tubs can also be really good. Injectables good if we're in a deficiency state, we need to correct something, or we know we're not going to have the opportunity to provide a free choice mineral. Boluses are kind of the same way. We know that they're actually given to the animal, so that's a good thing, but it does include us working the animal, and they don't always last a long time. Okay, intake considerations. We know we have non-consumers and over and under consumers, and so we need to make sure that we are paying attention to mineral intake, okay? That may be you looking at the tag going, I have a 4-ounce mineral, and just writing down, I put this many bags out, it's been this many days, there's this many cows, this is roughly how much they're eating. Are they over or under consuming, okay? Move the mineral away from water if consumption is excess, okay? A lot of times they're kind of bored when they go to water, they're gonna go over and eat some mineral and over consume, okay? Or we can consider changing the formulation. If mineral intake is inadequate, we can add protein meal or dry molasses as a carrier. We can move the mineral feeder closer to the water source, and we can also consider changing the formulation. Maybe we have a palatability issue. Salt is our friend, okay? Cattle crave salt, and we can control intake with salt, okay? So sometimes we have overconsumption because there's not enough salt in our mineral, okay? Maybe we need to add salt, provide a secondary source of salt. Okay, there's options if we need to increase or decrease salt in our mineral. This is kind of just the same thing as far as making sure that intake is relatively even. Okay, again, if we have over or under consumption of that mineral, we need to make sure that we're trying to fix that. Okay, if we know I need to put this many bags out every week or every 2 weeks and then cleaned it up, that doesn't necessarily mean I need to put more out. It could be they're over consuming and I need to wait to put out until it's time. So selecting a commercial mineral supplement, okay, know the requirements of your animal, test your forages, know the bioavailability, read your feed tags, Okay, they're gonna tell you what that mineral is formulated to do. Okay, it's gonna tell you if it's for grazing cattle. It's gonna tell you all of the sources of mineral that are available on there. Okay? And then monitor your daily intake. Okay, this time of year when we're doing taxes, sometimes that's a good time. You can go through and say, I bought this many pounds of mineral, I have this many cows, and calculate out roughly what my mineral intake was. Okay, then we know, okay, this year I need to provide more mineral, or I'm providing too much, I'm wasting some money. Okay, so just to kind of sum up, we can have primary or secondary deficiencies. Make sure we're understanding the difference between those. Okay, know what your mineral content is in your forage and in your water. Monitor intake, and that cows do not have nutritional wisdom, unfortunately, right? They need us to give them some help. My last plug is that I'm actually doing a mineral nutrition for the beef cow herd program. It's an extension program where there's some educational opportunities. So there's webinars in May. Then I schedule a ranch visit for you. I come out, I help take forage and water samples. We talk through what your mineral program currently is. Maybe you're doing great, we don't need to change anything, okay? And then there's some more webinars in the fall. It also gets you a discount with Ward Labs for sending in samples for a year, so that can be kind of a good perk if you want to be doing mineral testing on your forages. So, I know I went a little over on time, but I'm happy to take any questions or talk with you guys afterwards. Hopefully I
That
didn't.
thing you just had, the last thing, is that, how do you find out to sign up for that?
So I will post some information, I will share it with Chance, but I can give you my card afterwards. We haven't specifically posted dates yet for it, but it should open up, and the webinars will be in May.
Is it statewide or is
It
it just?
is, it's actually statewide, and it's actually in South Dakota, North Dakota, Montana, and Wyoming. So we kind of cover all 4 of these states, and I get to come out and help you and sit down and talk through your minerals with you. And my email and contact's on the last slide, so I'm always happy to answer questions if you guys want to talk more, be bored more with minerals. Thank you.
Thank you.